Bismillahirrahmanirrahim. Assalamu alaikum, my YouTube family. So here's our last episode. I'm in episode 5 of our CVS lecture series. Let's get start with it. Chronic heart failure, which is called CHF. General information: heart not able to supply enough oxygen rich blood to body. Impaired ventricular filling or ejection of blood, mostly due to damage from MI or long-term hypertension. Labs: BNP benign, प्रोटीन नॉर्मल 100 से ज़्यादा होती है पर मिलीग्राम. सो एंटी प्रो BNP जो नॉर्मल रेंज हमारे पास है वो 300 से ज़्यादा है, ये से कम होगी, इससे कम होती है. तो अगर 100 से ज़्यादा और 300 से ज़्यादा है आएंगी, ठीक है, which is normal is 100 and 300. Medicare penalize hospital for excessive readmission. ACC, AHA, HFSA guideline about diagnosis: CHF due to systolic contraction, diastolic relaxation. Echocardiography, ECHO, LVEF, left ventricular ejection fraction 40% से ज़्यादा, या फिर इससे जो है वो कम होगी, तो इसका मतलब है यू आर सफरिंग विद CHF. Sign and symptom: general sign dyspnea, SOB, which is called shortness of breath, cough, fatigue, exercise capacity decrease हो जाएगी. Left side और right side: left side preserved and right side reduced. If your left side orthopnea, paroxysmal nocturnal dyspnea, you mean in night you face during sleeping, cough, SOB at night I have mentioned, which is called paroxysmal nocturnal. Raise cracking sound, RS3 gallop, abnormal heart sound, and hypoperfusion, renal impairment or whole extremities. Peripheral edema, ascites, abdominal fluid, JVD, neck vein distension, hepatojugular reflex, HJR, neck vein distension when pressure applied abdomen. Hepatomegaly in large liver due to fluid congestion. Ejection fraction ranges 55 to 70% for normal, ठीक है, okay. If 50 less than 50 or 50, then H heart fail plus preserved ejection fraction, diastolic dysfunction, and impaired ventricle and relax feeling during diastolic. 40 to 49 के करीब आती है रेंज, हार्ट फेलियर प्लस मिड रेंज EF or mixed systolic diastolic dysfunction. So if 40%, less than 40%, then heart fail, reduce EF, systolic dysfunction, impair ability to eject blood during systole. Drugs that worsen heart fail: so anti-arrhythmiatic, procainamide, quinidine, amiodarone, dofetilide. Oncology: anthocyanin, doxorubicin, daunorubicin. Known DHP: thiazum, verapamil, NSAID, celecoxib. TNF alpha inhibitor, etanercept, rituximab, zolidinidione, itraconazole, systemic steroids, amphetamines, electrodes, alcohol, triptans. Other oncology agent: leptatinib, sunitinib, imatinib, trastuzumab or docetaxel. So what is a pathophysiology? CO is equal है कार्डियक आउटपुट इक्वल होता है हार्ट रेट प्लस सिस्टोलिक SV. सो CI is equal है CO डिवाइडेड बाय BSA. CI is कार्डियक इंडेक्स इज इक्वल होता है कार्डियक आउटपुट और BSA के रेटेड टू CO टू साइज पेशेंट्स बॉडी वेट. तो यहाँ पर BSA इज बॉडी वेट के अकॉर्डिंग. ड्यूरिंग लो कार्डियक आउटपुट neurohormones are released and increase BV and force speed of contraction, leading to temporary increase in CO. Over time is remodel the heart. Cardiac remodeling involves RAS, SNS, vasopressin. RAS plus vasopressin constriction plus H2O. RAS is renin-angiotensin system. H2O retention. SNS central nervous sympathetic nervous system increase heart rate, contractility, inotropy, and vasoconstriction. Natriuretic peptides normally contract hormone but are insufficiently expressed during this time. Staging and classification. ACC or AHA staging A, B, C, D. Okay, so according A, high risk for developing heart failure but has no history or structural heart disease. X patient with hypertension, CAD, coronary artery disease, diabetes mellitus, obesity, metabolic syndrome. B, structural heart disease but no sign and symptom of heart failure. History of LVF, low EF is left ventricular hyperplasia, low ejection fraction, valvular disease, previous MI. C, structural heart disease, prior or current symptom of heart failure. D, advanced structural heart disease, symptom of heart failure at rest despite medical therapy. NYHA classification 1, 2, 3, 4. 1. No limits to physical activity, no symptoms of heart failure. 2. Slight limitation of physical activity, compare at rest, but symptoms occur with physical activity. 3. Marked limitation of physical activity, compare at rest, but symptom caused by minimal exertion. 4. Unable to carry any physical activity with symptom of heart failure or symptom of occur at rest. So known pharma treatment and a pharma treatment. So what about known pharma treatment? Monitor body weight daily, sodium restrict 1500 milligram per day, less than, fluid restrict 1.5 to 2 liter per day, stop smoking, alcohol and other drugs, get flu and pneumo vaccine. This vaccine is important. If the question is, you can get the MCQs, which vaccine is very important if you are a heart patient, which is flu and pneumo vaccines, because it prevent infection, heart infection. And WT reduction minus BMI with weight reduction or BMI less than 30. Exercise, notify PCP if weight increase 2 to 4 lbs per day or 3 to 5 lbs any pound per week. Okay, or if symptom worsen, SOB, cough, sneeze, edema, more fatigue and pillow or orthopenia. Okay, treatment. Main pharma treatment is in herbs or ARNI. Okay, all risk of hyperkalemia में आप ये देंगे. Okay, and combo with ARNI common. Never combine all three. Use with NSAIDs worsen renal function. If you are using with NSAID, A's and herbs lithium toxicity cause करती हैं. Beta blocker. Only 3 recommended in heart failure: bisoprolol, toprol, XL and carvedilol. Avoid beta blocker with ISA activity. Stop if hypotension or hypoperfusion occur. Mask hypoglycemia symptom. So check this. Metoprolol IV, PO not EQ. Okay, लेनी है. And known selective beta blocker decrease insulin secretion or hyperglycemia. Other is loop diuretic, basal storage of the water. OTC में हमारा omega 3 FA 1 gram और thorn COQ 10. Avoid ephedra, ephedrine, decongestant नहीं लेने आपने इस तरह के. Drug shown to decrease mortality and drug with no mortality benefit. Okay, what kind of drug will decrease mortality? A's and R recommend for everyone. This is the first line. RNI, sacubitril, valsartan, Entresto, NYHA class 2 or 4 patient who have decreased ejection fraction. Beta blocker recommended for everyone. Aldosterone receptor antagonist, which is a aldosterone receptor antagonist, ARA which is NOAHA class 2 patient, class 2 and 4 patient, hydralazine or nitrates, BIDIL, which is black patient, NYHA class 3 and 4, add to A's and ARBs, or other patient who cannot tolerate A's and ARBs. You can use hydralazine and nitrates. With no mortality benefit or morbidity only, loop diuretic reduce BV, edema, congestion, most patients with symptoms relief. Digoxin provides small increase in cardiac output to improve symptoms. Ivabradine, Caldanor, NYHA class 2 and 3 with normal sinus rhythm plus resting at heart rate is more than 70 bpm or 70. So here mortality mean it decrease the chances of death or any other disease severity, and in morbidity it's about a symptom cureness. Okay, so this is about a cureness of symptoms. Let's talk about drugs. So the drug we can use, which is loop diuretics, works on thick ascending loop of Henle, and I have detailed bit about in hypertension lecture. You can get there. So the brand available is furosemide Lasix, torsemide Demidex, bumetanide Biomex, ethacronic acid Adigreen. So they act sodium chloride, potassium, magnesium, calcium and H2O level and decrease their reabsorption from loop of Henle. Sorry, areas. Carbonate ion increase which lead to alpha losses, hyperuricemia, hyperglycemia, triglyceride, total cholesterol, orthostatic hypertension, photosensitivity, ototoxicity, lithium toxicity. Warning: profound diuresis leading to fluid and electrolyte depletion. Contraindication: anuria, sulfur allergy, avoid NSAIDs, not sodium and hydrogen ion cause retention, and monitor renal function, fluid status, blood pressure, electrolyte or diuretic testing. Notes: furosemide injection must be room temperature, may add to thiazide if loop isn't enough, metalazone. Dose conversion: oral furosemide 40 mg, torsemide 20 mg is equal है, bumetanide 1 mg is equal है, ethacronic acid 50 mg. Furosemide IV और oral रेशियो 1 and 2, IV 1 देंगे तो oral 2 देंगे, 20 से 40. तो 20 अगर IV होगी तो 40 mg oral होगी. Generic enalapril, ramipril, lisinopril and quinapril, cetapril, fosinopril and trendolapril. So these are ACE inhibitor, block angiotensin 1 into angiotensin 2 vasoconstriction, aldosterone secretion, block bradykinin degradation. Brand available: enalapril, Vasotec, ramipril, Altase, lisinopril, Prinval, Zestril, Curales, Quinapril, Acupril, Captopril, Capitin, which is taken sublingual before, but now we can ingest it and it show absorption in GI. Trendopil, Mavic. So EDRs, cough, dizziness, headache, rash. Warning: not in pregnancy. Contraindication: angioedema, use with aliskiren, renal impairment, hyperkalemia, hypotension, weight 36 hour for naproxen or sacubitril or valsartan. So these are the contraindication. Note: monitor blood pressure, potassium ion, renal function, sign and symptoms of heart failure. Titrate to target dose. Can combine with ARAs, never with ARBs. Black ARAs is adrenergic receptor agonist. Black higher risk of angioedema. So ARBs block binding angiotensin 2, ठीक है, ATI and TRAS decrease. So the drugs available is candesartan, losartan, valsartan, candesartan, atacant, losartan, Cozar, valsartan, Diovan. ADRs, less cough than AIDS, dizziness, headache, rash, not in pregnancy, less angioedema than AIDS, use with aliskiren, not recommended, renal impairment can occur, hyperkalemia, hypertension, no washout period. Monitor blood pressure, potassium, renal function, sign and symptoms of heart failure can combine with ARA, never with ACE. Next, angiotensin receptor plus neprilysin inhibitor, ARN, which is called angiotensin receptor plus neprilysin inhibitor. Okay, the drug is sacubitril, valsartan, and Presto. Cough, dizzy, not in pregnancy, used with ACE and ARNI. History of angioedema, washout with ACE, 36-hour warning. Angioedema, renal impairment, hyperkalemia, hypertension. So not contraindicated in this patient, in this condition. Indication: patient who cannot tolerate ACE and ARBs, monitor blood. You can indicate Entresto or sacubitril or valsartan, ARNI. And potassium, blood pressure, renal functions, heart failure must be monitored. Okay, beta blocker, bisoprolol, Zibeta, metoprolol succinate, ER, toprol XR, and carbidopa, coric, take with food. Remember, carbidopa you have to take with food. Beta blocker block catechol ENI, norepinephrine, vasocatecholamine, vasoconstriction decrease, improve cardiac function, cardiolol, and non-selective beta blocker. ADRs, heart rate decrease, TG increase, hypertension, fatigue, dizziness, libido, and impotency can occur. Warning: abrupt discontinuation, take or taper off over 1 to 2 weeks. Contraindication: bradycardia, second to third heart blocks, sinus syndrome, cardiovascular, hepatic impairment cause करती है, mask hypoglycemia. Note: only 3 recommended in heart fail. Avoid beta blocker in ISA activity. Stop if hypertension or hypoperfusion occur. Metoprolol IV, oral not equivalent. अगर आप IV और oral यूज करें तो equivalent नहीं है. Monitor blood pressure, potassium, renal function, sign and symptoms. Aldosterone receptor antagonist. Okay, aldosterone receptor antagonist is spironolactone, eplerenone, spironolactone, aldactone, carespir, non-selective और ब्लॉक एंड्रोजेंस. एलिप्रोनॉन इंस्प्रा के नाम से अवेलेबल है, सेलेक्टिव, नो एंडोक्राइन फंक्शन. सो ADRs, hyperkalemia, serum creatinine increase, disease, spironolactone, gynecomastia, breast tenderness, impotence. Spironolactone tumorigenic है, so warning, which is not that recommended. And hyper contraindication, hyperkalemia, Addison disease, anuria, renal impairment, creatinine clearance 30 से कम हो तो then renal impairment है. You have to check this, or not recommended in those patients. Do not initiate in heart fail patient who potassium ion less than 5 or serum creatinine 2.0 or less than 2.0 in female and male 2.5. Monitor blood pressure, potassium, renal function, sign and symptom of heart failure. Okay, next is hydralazine, arterial vasodilator, which is available. Hydralazine plus isosorbide dinitrate, pedal, heart headache, reflex tachycardia, palpitation, fluid retention. ADRs, drug-induced lupus erythematosus, which is dial. Warning: CAD, mitral rheumatic heart disease can occur. Contraindication in those patients who have rheumatic heart disease and CAD, coronary artery disease. Indication: cannot tolerate ACE and ARBs, you can use this drug. And black class 3 and 4 with sign of despite optimal treatment. Tachyphylaxis need 10 to 12 hour nitrate free period. Okay, so Imdur or Monocat, which is isosorbide mononitrate class nitrates, no cause vasodilation, preload. So ADRs, headache, dizziness, lightheaded, flushing, hypertension, tachyphylaxis, syncope. Okay, warning: Avanafil wait 12 hours, sildenafil wait 24 hours, Vardenafil wait 4 hours in 1 day, and tadalafil wait 48 hours if you are taking nitrates. So contraindication, use of PDE5 inhibitor and Yosigot indication. Same indication I have mentioned in middle. Cannot really tolerate ACE and ARBs. You can use this. Black class 3A4 despite optimal treatment. Tachyphylaxis need to tolerate nitrate free period. So digoxin. Digitac, digoxin, lanoxin treatment range heart failure 0.5 to 0.9 ng per annum. Inhibit sodium potassium ATPase pump plus inotropy, increase cardiac output. Dizziness, mental disturbance, ADRs, nausea, vomiting, diarrhea, and NVD I have mentioned earlier. So this is nausea, vomiting, diarrhea, and headache. Headache, warning, second and third heart blocked, toxicity, nausea, vomiting, loss of appetite, and bradycardia. Contraindication, ventricular fibrillation, improves renal impairment function, electrolyte. You have to contraindicate in those patients. Notes: improve QOL symptoms, exercise tolerance, lower dose in female, small size renal impairment, and no mortality benefit. So potassium increase, magnesium decrease, calcium increase, risk of digoxin toxicity. If calcium increase and potassium increase, the risk of digoxin toxicity increase, but no mortality benefits of morbidity drug. So the other is HCN blocker, block funny IF current in sinus mode. HR heart rate decrease. IF. Ivabradine, Corlanor, bradycardia, hypertension, and AFIB, luminous pneumonia, flushing light. It's called luminous phenomena. So bradycardia, QT prolongation, arrhythmia warning, contraindication, acute, decompensate heart failure, blood pressure 90/50 less than, sinus syndrome, atrioventricular block. Notes: target resting heart rate 50 to 60 BPM indicated for NYHA class 2-3 with ejection fraction 35 less than 35 plus 6 sinus rhythm plus heart rate above 70 ppm. So potassium chloride supplementation, contract loop diuretic, loss of potassium, and arrhythmia risk with digoxin. Chlorcon M20 micro K. So supplementation, this is a kind of supplementation. Nausea, vomiting, diarrhea, hyperkalemia, flatulence, abdominal pain, contraindication, renal impairment, hyperkalemia. So other is take with food. Okay, so take with food micro K may open and sprinkle capsule. K-tab, chlorcon, swallow whole, chlorcon M20, swallow whole, or cut 1.5 or dissolve in 4 ounce water. So this is the end of our cardiac series. I love if you mention your thoughts in comment section, and if you like my video, keep me motivated, and you want me to keep me motivated, please subscribe and like and share my channel. Thank you. Allah Hafiz. Till next series, which you can also suggest me in comment section. Bye.